Well, hello everyone. I'm Dr. David Ajibade with the Brain and Body Foundation. And if you recall, in a previous episode, we had Major Dr. Shei Bade Alabi, that's a mouthful, was on the show with us. And she gave a lot of gems about what happens when a military person is exposed to combat, and not just combat itself, but even during the training and the preparation, that there are certain things that affect the brain and body that in some cases could be just temporary, but if not managed properly, could be more prolonged and in some cases lifelong, not affecting not just their service while they're in the military, but afterwards. And so in this session or in this episode, I really want us to go into it a lot more and really look at the protocols and, shall we say, up-to-date research and protocols on how to treat such cases, but also how to mitigate against so many soldiers coming down with brain injuries and mental health conditions. And that's a lot to unpack. So I'm hoping we can fit all that in this 25-minute segment. But most importantly, we're going to start with why this needs to be done. So without further ado, I'm going to welcome Dr. Shei Bade Alabi to the show today. Welcome again.
Thank you, Dr. Ajibade. Nice to be here.
Absolutely. And I got to tell you, there's so much that we need to unpack. Just as a reminder to our folks, Dr. Shei Bade Alabi is a physiatrist. She works with rehabilitation, amongst other things, at the Walter Reed Hospital. She's also an assistant professor. So she has several hats. She's a mother of 3 children. She has several hats that she's working with. But what we're concerned with now is the effects of military service on the brain and body. So let's get into it. First of all, let's start with, if these things aren't paid attention to, let's talk about what you're concerned about, both short-term and long-term.
Yeah, so, if we don't address the issues that come along with a military service, and in particular, the effects of combat on the brain and body, then short-term, what we are experiencing or what we are seeing is that service members are less productive in their service to the military. They often have more chronic injuries, so that could be anywhere from a sprained ankle to chronic back pain, chronic neck pain. And so there's a lot of lost time or work hours related to needing time off from work to go and seek medical care, and so on and so forth. And as well as inability to multitask and to be as sharp as they need to be in the combat zone, as well as when they're in garrison. Those are concerns, because then they are potentially putting themselves and their colleagues or their battle buddies in danger, because we all know that being able to make a split-second decision accurately can be the difference between life and death on the battlefield.
Absolutely.
So brain injury, which impacts your reaction time, impacts your cognitive processing speed, impacts your judgment and accuracy, especially when you're dealing with weapons of mass destruction. That is an absolute safety risk. So putting those that are suffering from undiagnosed or unrecognized injuries, such as a brain injury, which is not physical, right? So we are all conditioned to noticing or recognizing when someone has an amputated leg. That's a physical injury. It's a tangible injury. We can see it, we can touch it. But many are suffering from invisible injuries to the brain and to the mind. We know the mind is one of the sharpest and the most valuable tools that a service member has, because your ability to make decisions and to be a leader and to do your job and to do it skillfully and do it well makes a huge difference in the success of a mission. So if you're going on a mission and you have men to care for as well as yourself, you want to make sure that you are operating at your optimal best.
Absolutely, absolutely. So that's in the military. That's in the well in the military. But you and I also talked about certain things with regards to what happens in the home front. And
Yes.
one of the reasons why they come to you, one of the things you said was very telling. Why one of the reasons why they come to you, because otherwise, let's face it, military people don't like going seeking medical attention, especially certainly not mental health attention. So let's talk about that.
Yes. So majority of my patients come after years and years and years of suffering that initially they're able to compensate. So younger soldiers, we know that we just are more resilient. Your brain is able to accommodate more, your body can accommodate more trauma, wear and tear. However, it gets to a point where you are no longer able to compensate and make up for those losses and impairments in your function. And that can be seen in many different ways, to manifest in many different ways. And so by far, one of the most common complaints is memory loss. So they come, those that are, well on their way, have had, like, let's say about 18 years of service, and they're getting ready to retire. They're worried about their transition into the civilian workforce. They're worried about their ability to provide for their families, ability to maintain a safe and stable home, as well as their marriages. So, like you said, majority don't want to seek medical help or attention, especially for anything that has to do with mental health. And so they often don't complain about their mental health, but they will say, my memory is not as good as it used to be. However, we all know that memory and cognition is very much tied into your mental and behavioral well-being. And so now that TBI is having more of an attention, is becoming more well known or more recognized as an injury, and it's an issue that needs to be addressed. And so majority come to places like the NICO, which is the National Intrepid Center of Excellence for Traumatic Brain Injury Research and Treatment. And so that is a more safe haven, but we often treat everything, especially the behavioral health, the mental health component, because if we don't address that, the cognitive and the mental, or the cognitive and the functional aspect of the injuries do not get better.
Okay, so let me jump in here real quick, because I definitely want you to mention this before the break. You said something about people coming there, coming to seek, and you gotta make sure you edit this up. You mentioned about people coming to seek your help because their marriages were being threatened. That their wives, their spouses gave them an ultimatum. Let's talk about that.
Yes, so that is one of the other common complaints, is that they're there because of anger issues and inability to maintain a healthy marriage. So we know that memory loss, not being able to remember conversations, will create conflict between a man and a woman, a husband and a wife. And then anger issues, where inability to regulate your emotion, your reaction, your response to situations is impaired. And so you are unable to tolerate much frustration. So we call that frustration intolerance, which is a component of traumatic brain injury. So your ability to have your executive function, which is the frontal lobe of the brain, to regulate when to react and when not to react. Say, for instance, let's say you misplace the knife, or you can't find a scissors. I mean, it's relatively a minor issue. Let's say somebody took it from where you had it and put it somewhere else, and now you can't find it. You are quickly frustrated, you're quickly agitated, And whereas you would normally respond with, okay, a more rational approach.
Right.
This in a TBI patients that have anger issues go from 0 to 100 over very minor issues. And so that can, you can see how that can easily create a unhealthy home environment and cause friction in marriage. And so a lot of my patients come because their spouses have given them an ultimatum, or saying that there's clearly something wrong. You need to get help, or else, I'm leaving.
So
So
they can get physical. They can actually get
right. So even
abusive.
if they're not being physical, their anger is such at a high level that there's a threat of being physical, and spouse is feeling unsafe. I also have men who've come in because they themselves realize that it's a problem, especially when there are children involved. They will say things to me like, I uh, I'm easily irritated and angry with my children. I don't want to harm them. They can feel themselves getting to the line. We know that children can test us, right?
Yeah.
Especially little children who
Right.
are still, they might be loud. You don't get much sleep. They're full of energy. They're doing things that are often irritating. But in this setting, their anger can be so severe that they're worried that they might actually do something physically to harm the child. And so they will bring themselves in saying, I'm concerned. So those are just probably the top three things, complaints that brings patients to our TBI center at NICO. Memory loss. So, saying they're frequently forgetful of where they put things, forgetful of conversations, forgetful of tasks or things to do. Say they rely heavily on writing everything down. They don't write things down. They easily forget. Trouble finding the right words in conversations. And, as a leader or officer, being able to brief effectively and sharply is very important. And so when you're not able to put your words together, or you lose your train of thought easily, or you can't remember what people have told you in prior conversations, that can be a very, very challenging.
So we're going to have to cut that out because we mentioned memory loss. So let's end this session by saying, let's just repeat the three things. Well, don't explain them. Just repeat the three things because we're pressed for time now. And then we'll go to the break where we can now come back and we talk about solutions. Okay, so you start from now.
I didn't understand. Just reiterate just the three things that bring people in.
Yeah, just recap the three things that bring people in now, and I'll stop you there, and then I'll go for the break.
Okay. Yeah. So the three most common complaints that my patients will bring to the TBI center are memory, being one of the most common complaints, anger, and I forget the third one. Sorry.
Spouse, or their spouse giving them an ultimatum or something.
Well, I mean, I guess I could lump that into the anger, but yeah, anger issues causing social, marital friction.
Okay. Awesome. All right. Well, very important stuff. So, folks, we will be right back after the break. Don't go away. Make sure you call your colleagues and your friends to come and listen to the remainder of this season. Okay. So we got 2:42. This was 2:30. So we've done about 12 minutes. 12 minutes. So we've got about 13. Let's go with 15 minutes. We've got 15 minutes left. 15, 2:42, 15, 7. I thought I was done with math. But here we are.
Can't get away from math.
Unfortunately not.
Mm-hmm.
Okay. All right.
Is it going okay so far?
So far, so good. Love the gems you're dropping. So I just want to make sure that we fit all this stuff in. So you just to know, you got about 15 minutes. You've got about 15 minutes to pack in the most important things.
Okay, so what do you want me to talk about? I can talk about ways to mitigate the effects of brain injury, which are, fortifying the brain basically against the effects of neuroinflammation that occurs with brain injury. So best ways to do that: magnesium supplementation, omega-3 fatty acids.
Okay, so what I would like is first of all high level stuff. Some of the things, recommendations, maybe you've passed across to the top brass. Whether or not they've accepted it is none of our business. Some of the things that you think that should be in place, whether deployment no more than 6 months, if there are complaints in the fields, the people should recognize that this is a valid issue, and they should treat them on the field there. They don't have to come back home on the field, put some things in place. So they can get intervention where and when they need it, so to speak. So I would say even the magnesium we're talking about, the people in the field should have access to magnesium, to omega-3s, to
No, so I mean, what I'm recommending is that yes, there are safety considerations, right? So limiting the exposure to repeated. So there are numbers of exposure per day for any explosive. People that are working with explosive ordinances, EOD, breachers, artillery, fires, they have to limit how much one person is allowed to be exposed to per day. That will help, preserve the brain. Cutting down deployments to being, more reasonable. So prolonged stays or tours in the field, in the theater, is unhealthy. I mean, I don't know the numbers or the statistics for what is a recommended amount of months. I'm not, familiar with that, but certainly, working to limit that for any one person is important. Recognizing the signs and symptoms of someone who's struggling with mental health or TBI is very important. And then also, making sure that they're taking in the right types of nutrients that will, when you are, because you can't, it's inevitable. So if it's common and it's part of the hazard of the job. So you're probably going to have a brain injury, or you're probably going to have a concussion. There's a high chance of that. But when you do have it, if you have the right things in place, then your ability to recover from it is a lot better. Okay,
perfect. So in the video when we talked last time, you said 99% chance that you're gonna have some kind of brain injury.
No, I did not say that.
Okay.
I said there's 23% of wounded soldiers in our recent conflicts have experienced TBI. I said 97% of those that have had TBIs, that are chronic mild TBIs, complain of sleep disturbance.
Well, I was referring to the when we talked on the way back. I took notes on that.
Oh, you mean like the percent, the risk or prevalence of TBI, or?
No. There's an at least a 99% chance that you will get injured in some way on deployments.
That I'll get some way.
That you'll get injured in some way.
Yeah. I mean, yeah, injuries are very common.
Injuries are very common. So there's going to be one kind of injury or the other. Anyway, but you said 23% is what? 23% of all what? Of all?
23% of wounded soldiers from our recent conflicts from OEF, OIF have experienced a TBI.
3% of wounded soldiers.
23% of, yes, combat injured from our recent conflicts, US conflicts, so in Iraq, have experienced TBI.
Okay, so I want to lead with that. And then we're now going to what your recommendations are. You mentioned the high levels, policy stuff, and then person to person, what you recommend, everything from sleep to magnesium to omega-3 fatty acids, but basically how you, and then of course the exercise and stuff that you recommend. So, sounds good. Okay. So we're gonna have to rifle through them because I don't want us to miss any of these things. So 248. 12 is.
What was the first one you want me to focus on? What's the first thing you want me to focus on?
The policies, recommendations to the high level stuff, safety considerations about the blast.
Yeah, I can't necessarily say these are policies, right? And these are my opinions.
Right.
I'm not representing the U.S. in any way at this point, or the department.
Got it. So I'm just using policy with you. So I'm just going to throw it to you, and then you say there are things that you recommend, and then your opinion, and then but I do want you to cover that, and just make a suggestion where that is concerned, because you see that the longer exposure leads to long-term damage, and then of course when it comes to the actual treatment, these are the things that you found out have been effective. So using drugs only when absolutely necessary, when you find that it's absolutely necessary, but we also do encouraging sleep, exercise, and of course those supplements that you've used over and over and over again, and you seem to be helpful. Anything else you can remember? Okay. So watch your timing, because I want to make sure that you rifle through these things. So don't get.
I think it's helpful if you just cut in and facilitate that.
All right. I don't want to mess up with your flow. So okay.
No. So I think you just interject and say, okay, what about?
Yeah.
So it's easier for me to answer a prompt or question than it is for me to just rattle through all those things, that I will get long-winded.
Okay. All right. So wounded have some form of brain injury. Welcome back, everyone. So I am here with Major Dr. Sheikh Badi Alabi, who is a physiatrist who works with injured combat members of the U.S. Air Force, U.S. Armed Forces, excuse me. And as I've mentioned before in the previous episode, this is of personal importance to me because I'm a military veteran myself, went to Nigerian military school, was in the 41st regular course in the Nigerian Defense Academy, and I've been in the military. I've maintained my contact with my classmates and friends from these schools. So, and I see that many people are affected by when they go out into military conflict, whether in terms of brain injuries or mental health or cardiovascular health. I mentioned before that sometimes 50%, 30 to 50% of people who are in the field for a long period of time tend to come back with some kind of increased hypertension or other kind of cardiovascular disease. So it makes sense for us to be considerate or work with these risks and make it easier, make the impact of warfare, mitigate against that. So let's put it that way. We should be able to mitigate against the impact of warfare and to ensure that the threshold that our minds and brain health of our soldiers, not just their physical bodies, are strengthened so that they don't fall easily into this hopelessness and despair that many of them tend to fall into, especially after they've left the military. So it's super important. And that's why I'm so glad we have Dr. Sheikh Badi Alabi on the show today. All right, so Doc, let's talk about some of the recommendations and some of your suggestions, or what you've seen have been helpful for helping the military. I'm gonna take a break here. Okay. All right, so I'm going to say it. So Yinka, I'm going to say it again. Welcome back, folks. I am here with Dr. Sheikh Badi Alabi, Major Dr. Sheikh Badi Alabi. And like I've said before, this is so important to me because I'm a military person. I was at heart. I was raised in the Nigerian military school, raised in the Nigerian Defense Academy for the first regular course. Congratulations to you all who have made Major General. God bless. Don't forget your people. And the military is near and dear to my heart, and I want to do what we can to ensure that military people, both during and after deployment and after their service time, remain productive members of society. It's so important. And it's hard to be that if you've had a brain injury or your mental health has been threatened or affected. So that's why what we're talking about with traumatic brain injuries, PTSD, and other mood disorders associated with warfare is so, so important. And that's why I'm so glad we have the doctor on the show today. So, Doc, let's start by talking about some of the protocols and the things that you have seen that are effective in your treatment and in recognizing these problems, and what you would like to share with other military personnel around the world.
Yeah, so I think the first thing you mentioned was talking about some of the things that we can do to prevent chronic injuries and brain and mental health from happening in relation to warfare. So preventative measures would be minimizing the length of time that any one service member is deployed. So being in a prolonged deployment setting will certainly predispose anyone, particular service members, to more adverse reactions to the mental health, as well as to the brain, or more risk and chances of getting injured. So here,
that's a bit of a challenge. I'm going to jump in and say that's a bit of a challenge, because in Nigeria we're being stretched. The forces are being deployed all over the country, with insurgents to the Boko Haram down south, with
right.
all the bunkering and everything, and then and all kinds of things going on. So that's a bit of a stretch, but keep going.
Yes, so certainly that's something you have to continue, trying to mitigate, but it's important to then also address any potential injuries or issues that have happened once the service member does come off of deployment. And so what we do is make sure that they're receive comprehensive evaluations to discuss those things, disclose those things, and give them downtime, convalescent time, so that they can seek medical attention, seek medical care as needed.
Before they come back, is there anything that can be done in the field to mitigate against this while they are there on deployment? We don't want to have to wait until they come back to their bases before they receive medical training care. What do you suggest?
Certainly. So during deployment, it's important that there is attention paid to the sleep or rest and work cycle. So leaders within the force must pay attention to work rest cycle, making sure that people have some downtime to rest and recover, especially after having a very difficult, challenging mission. And while there, also it's important to recognize the signs of mental health struggles or cognitive challenges in any particular service member. Because I mentioned before, these things will mitigate or will undermine the effectiveness of that service member and the safety of their comrades in battle. So being able to think clearly and precisely is very important on the battlefield. So if you notice someone that is struggling with, anger or, either depressive moods or hopelessness, those are signs, those are immediate red flags that possibly that person is maybe struggling with depression, anxiety, or any kind of suicidal ideations. And those should be immediately addressed.
Or they're drinking a lot,
so yeah, excessive alcohol use, yes, erratic behavior. So noticing a personality change, someone who's normally calm is now very angry and volatile, behaving differently or more blunted of an affect, blunted affect. Those are things that leaders should look out for and try to intervene.
And I think you mentioned something too that I think is very, very good. Providing, and we're going to talk about some of the nutrients that you use at the main hospital, but actually talking about providing some of these, having them available there, so that if people recognize these problems are beginning to happen, that they can start actually using the nutrients. They're not medications, with their nutrients to probably help to fortify their brains or improve their mental health there and then in the field. What do you think about that?
And that's a great idea. I would even argue that it's better to have it as part of the deployment package. So when you're being deployed, we know you have to update your equipment, make sure that you have the right tools, uniform, and so on and so forth for the mission. However, we often neglect the things that we need to arm our body with in order to endure the stress of combat and endure and prevent adverse or chronic effects of that exposure.
All right. So what nutrients what would those be? We definitely want to have those. So what would be what should be part of your kit, in other words?
So in terms of brain health, it has been proven that omega-3 fatty acids are very vital in maintaining the integrity of the brain and the neurons. And so nerves and neurons need omega-3 in order to function properly. So making sure that we supplement soldiers with that, just once daily, 1,000 milligram fish oil supplement will go a long way. So that when, in fact, an injury occurs, which we say again, 23% of service members experience TBI or concussion, they are able to recover a lot quicker and faster.
Mm-hmm. Okay, so omega-3, it's what else? I would throw in zinc, and I would throw in magnesium as well, because you mentioned magnesium, and I was impressed with how you use it in at the hospital and the effects you get from it. Do you want to say a quick thing about magnesium as well?
So magnesium has been proven, especially as a treatment for migraines. We know, again, like I mentioned, concussion, one of the most common side effect or most common symptom or complaint is migraine headaches. And magnesium has been proven to be efficacious in treating migraine headaches. One of the main reasons it helps is that it limits or mitigates the inflammation that comes from insults or injuries to the brain and the head. So using it prophylactically, even before an injury occurs, will help patients or service members to recover more quickly or faster, more effectively, more efficiently after an injury. It does a lot throughout the body in terms of maintaining sleep, overall wellness, mitigating anxiety, stabilizing the neurons and the nerves and the muscles so that you can continue to be at your optimal when you're in the environment, in the service environment.
Awesome. That's great. So omega-3s, magnesium, like I said, I mentioned zinc, vitamin D, especially for we Black people. You know, yes, I'm always talking about vitamin D.
Very important.
Yes. And then vitamin C, because vitamin C helps to repair. I mean, it's important for repair of pretty much every tissue in the body, right?
Yes,
vitamin C.
Yes. Agreed.
All right. So anything else you think should be added to this? I've mentioned 5 now.
What's that?
I mentioned 5. Anything else you can think of, or that you guys use over there?
Well, this is not necessarily a policy right now, but is a recommendation that I would like to propose, that we should be more preventative and less reactionary. There's still a lot to be found out in this arena of brain and mental health, and so. But these are the things that are being shown to help after injury, and I would like to propose that it's best to begin before an injury so that the body can recover and you have the less morbidity, less chronic health. The burden of these injuries on the healthcare system, the military healthcare system, is quite high. So what we can do to mitigate that will be highly effective. And these are very simple solutions. They're not drugs, they're supplements, and they're relatively cheap.
Absolutely, and that all that works for people in third world countries as well, especially for those of us in third world countries where we don't have access to all the super duper MRIs, fMRIs, CT scans, and all the things that are so readily available over there. And of course, the ability to monitor drug levels, blood levels of different things. So, but these things that you've mentioned, I think, are, like you said, safe, and they're relatively cheap. So that's great. Right. So in the few minutes we have left, what happened when they come to you at the hospital? I know you mentioned a few things like sleep, making sure that their sleep hygiene is improved upon. We've mentioned Medicaid, we've mentioned good supplementation. Uh, Anything else you do in terms of uh, maybe exercise, or what else do you do for them? Because you mentioned the whole comprehensive approach to this.
Yeah, so this requires, so TBI is a multi-system injury. It affects everything from mood to your physical, health in terms of chronic pain. So those who've had TBI are more likely to have chronic pain, either neck, low back. So we have to address all of those things. So if you are suffering from chronic pain, your ability to recover and to actually rehab the cognitive, the mental aspect is going to be very impaired, right? So if you're preoccupied by your pain, you cannot really focus on your rehab for your cognition. So we have to address their pain through medications as well as through therapy. So physical therapy often helps. Yoga, mindfulness are all things that we use to mitigate pain. As well as treating the sleep. So sleep is important for just about everything. Your brain is able to repair, your body repairs itself during sleep. So if you're not getting adequate sleep, there's nothing that we can do with medication or treatment that will actually have any long lasting effect. Sleep is very critical and it's something that you have no control over. It's very automatic, but there are things that you can do to make sure that you have more of an improved quality of sleep so that your body is given the right tools to repair itself.
Such as making sure that you sleep in a dark room, or at least
So,
covering your
so
eyes, no
it-
noise, no cell
yes,
phone
yes. So staying off your
around
cell
you.
phone within the 1 or 2 hours before sleep, minimizing blue light exposure, again, from all of the devices, your laptops, things like that, making sure that your room is nice and dark and cool, at least 68 degrees is what's recommended. I mean, it's not always possible, but you can certainly try. Doing things that help with relaxation, winding down, such as just doing your stretches, breathing exercises to calm the mind, calm the body, taking supplementation such as melatonin and
Melatonin.
magnesium is very helpful in getting more falling asleep easier and staying asleep. And you want to make sure that you're getting at least 6 to 8 hours of sleep a night. Not always possible, but we can
Yeah, that's
always
not
try.
gonna that's
Um,
not gonna happen.
but if you're not
But
able to get an amount of sleep, what's more important is actually the quality of sleep.
quality of sleep,
So
right?
wearing these like devices, wearable devices like Fitbits and smartwatches help to tell you if you wear it at night to sleep, you can see what type of sleep you're getting. And so then you can have figure out what tools to use to improve your sleep. Um, Again, much of this is dependent on your autonomic nervous system, which you don't have any control over. But things that help to regulate your autonomic nervous system to make it more effective are breathing and relaxation by far. Medications do not help. Breathing, relaxation activates your autonomic nervous system and allows you to fall into a deeper sleep.
Fantastic, fantastic. So much to learn, so much to know. And I, as you folks, as you know, I can very much relate to what she's saying, especially when it comes to supplementation, because we've used these very same supplements that she's talking about over and over and over again under the supervision of the federal government of Nigeria, by the way, on severely brain injured children. And we've seen significant improvements. So if it works in kids, you can be sure it's going to work and be safe in adults as well. And so again, if you work with the military or in the military medical corps, please take this to your bosses at the top, your guards at the top. These are things that should be part of our strategy. Again, these are not protocols that she's just suggesting. She has seen that the doctor has seen that these are things that have worked when they've worked with patients, both on the fields and in the hospital. So it's very important that you consider using supplementation. Doc, but this is great. Now, let me ask you this.
I just want to clarify for a second that even though they're
Yes.
not necessarily protocols, These are clinical practice guidelines is addressing sleep, chronic pain, addressing the mental and behavioral health of the soldier, and having more of a comprehensive, holistic approach is definitely been studied and is a clinical practice guideline recommendation.
Fantastic. Thank you for clarifying that. So one more question. Once you apply these things, how likely is it that the soldiers get full recovery?
So that depends on the soldier. It depends on the severity of their injury and the chronicity of the injury. So if you've been struggling with something for over a decade, you're likely going to need anywhere from 6 to 12 months of treatment and therapies, interventions to start getting better. And even then, we cannot necessarily guarantee that there will be full 100% recovery, but there will be optimal, or there will be beneficial recovery to the point that you are able to be a better and productive member of society by having the right tools. By far, the most that we offer our patients is education. The education of understanding what it is that your body has gone through, why you're feeling the way you feel, and arming you with resources and tools and education of how to deal with those things, so that we are empowering our patients and not necessarily, we don't do the healing. We don't do the actual process. We're giving you the tools and creating the environment so that your body can do the healing and yourself.
Absolutely. And that is education. Knowledge is power. Education is also important for the families as well. So even the spouses can understand, get an inkling or insight into why their spouse is behaving the way they do. And
yes, very important. Yeah.
You'll have more consideration and sympathy for them rather than reacting to the way they are reacting, right?
Yes, our programs actually incorporate the family. We do family therapy so that the spouses are brought in, they're educated as to why they're seeing what they're seeing. And so the better they understand, the better they can come alongside the service member to support their recovery and their healing. We do family therapy in terms of helping with marriages, because again, communication, if you're struggling with memory and you're struggling with all these other things, being able to communicate in a very effective way with your spouse is going to be limited. And so we have to help with those, to provide those tools, because your family is all you have at the end of the day to help you through these problems. And so anything we can do to preserve those relationships will be helpful.
Absolutely. That's so fantastic. Thank you for what you do. Thank you for this information. I think it's going to be of benefit to so many people. Well, folks, this ends it. Thank you for listening and joining us on this program. Dr. Shea, Major Dr. Shea Bade Alabi, and that's a mouthful, for a very, very smart and
also known as Dr. G. Yes.
Also known as Dr. G. That's a lot easier. Why did you tell me that before?
I did.
Just kidding. Just kidding. Thank you so much for your time.
Thank you for having me. It's been a pleasure.
All right, folks, take care, and we will see you next week. That's fine. Awesome. Okay. Whew. I think this was, what do you think about this one? I think this was even better than the last one was.
I think so.